Hi, I'm Kendra Falk Edwards, and I'm the Chief Marketing Officer for CarDon and Associates. And I want to welcome you today to the CarDon Resource Hub, where we take the most frequently asked questions in senior living and answer them with industry experts. So let's get started. Courtney, I am really excited to have you on today to kind of talk about UTIs with seniors, because this is something that I think people don't understand the impact and the signs and symptoms and what can happen when a senior has a UTI. So if you wouldn't mind telling us a little bit about that.
Hi, my name is Courtney Bumbalough, and I'm a nurse practitioner with Proactive Clinical Partners. And I have been with this company for 3.5 years. And we actually, around in different nursing homes, we provide primary care. So thank you very much for giving us the opportunity to be able to, just kind of reach out and talk about UTI and what symptoms that we can see. So first, we'll go over some of the common symptoms. These are the symptoms that young children all the way up to elderly can experience. So one of the most common is burning with urination. Very common. They feel it before, like right when they start urinating and until the end. And then another common one is frequent urination, where they feel like they are continuously needing to urinate. Another symptom is that they have suprapubic pain. So suprapubic pain is like lower abdominal pain. So they just, have this pain. They're not sure. They're having stable bowel movements. What could this be? That's another symptom to look for. Another one is new onset of incontinence, or where they're unable to hold their urine. So sometimes we see this, or if we see an increase in incontinence. So they have incontinence, but now they're even more. That's another symptom that we can see. Another symptom is flank pain or low back pain. That can be another symptom of a UTI. So those are just some of the very common symptoms. One other one is blood in urine. So if they start to notice any blood in their urine, that is another thing that we will work up for a UTI.
Courtney, what are some of the unusual symptoms in seniors that you see? Because I know it can impact people very differently.
Yes, definitely. So a lot of times seniors, they will present differently. They won't have those common symptoms. Or and we have a lot of dementia patients where they're unable to communicate those symptoms to us. So some of those symptoms that are unusual are increase in confusion. If they're just, have increased away from their baseline, if we see more frequent falls. So if we see that they're having a lot of falls, that's another symptom that we can see. If we see more agitation, so a change again in their baseline mood, if they seem more agitated, unfortunately, they're not able to communicate to us that, maybe I am having this burning, but they're more agitated. So that will be a red flag that, hey, maybe we need to work them up for a UTI.
When do you suggest that people get treatment? And is there anything that seniors can do specifically at home for treatment?
So definitely seniors, I err more, I guess you would say, on the side of caution, just because a lot of times they have a lot more comorbidities. So we want to make sure that we get this infection taken care of as soon as possible. If they start with any of the previous symptoms that I have spoken about, I would say, go ahead, reach out to your primary care doctor, reach out to a clinic, just so you can get your urine tested so that we get it taken care of before we are dealing with a severe infection. Now, if you start to have, like with seniors at home, increased confusion, falls, that may be where we need to go ahead and go to the emergency room just so that we can have a quicker workup done. And then some things that we can do at home to help prevent urinary tract infections. One thing is just make sure you're getting adequate fluid intake. I know a lot of times that we don't drink as much as we really should. They say about 2 liters a day, unless, of course, the doctor has given you a fluid restriction for other purposes. Another thing is if you have a UTI, you're prescribed an antibiotic and you take it, but then your symptoms are better, sometimes they won't finish the full course of the antibiotic. So even though you're feeling better, you need to make sure that you fill or complete that complete course. And then for females, just make sure you're wiping from front to back. That's just helping prevent any UTIs.
Thank you, Courtney. That's so helpful because I think people don't realize always the impact that a UTI, when you talked about mental status and falls and different things, that it's attributed to a UTI, and making sure to get tested for that, I think is so very important. So thank you for that.
Yes, of course, definitely something that is very common, and we see in the elderly, we see in the general population. So it's something that it's good to be aware of the symptoms and even of the uncommon symptoms.
Great. Thank you for sharing.
Not a problem. Thank you so much.